Hey, Dr. Islam here. So I'm going to go over all the different things and modalities that we can offer to help any erectile dysfunction or just improving the quality of your erections. Okay. First, I think most people know is Viagra, Cialis, Vardenafil, which is sildenafil, Tadalafil, Levitra. Okay, Vardenafil. Sorry. Now, with these class of medications, these PDE5 medications, they typically increase the blood flow to the penis, and they're actually great as long as you can tolerate them. Okay. They provide a stronger and harder erection, and there's no doubt for it. It's beneficial. Even a low dose Tadalafil, I actually recommended that you take a low dose Tadalafil daily as long as you can tolerate it, because it just overall improves the quality of your erections as well as keeps your blood vessels more open. So, and it also increases your bioavailability of your testosterone. So now coming on to the next part, testosterone. So testosterone, even a low dose testosterone, is beneficial for men over 30s. It actually can improve the quality of the erections as well as, but it does take some time. Usually it can take anywhere between 6 to 9 months with testosterone to actually have improvement of erection quality. Now, in part with libido tends to increase much more quicker within a couple weeks. That said, there is another class of medications called trimix, bimix, trimix, quadmix. So these medications are actually, you're injecting a little bit of medications right into the corpus cavernosum, so the spongy tissues of the penis, and they directly allow the penis to increase blood flow and create a strong and hard erection. This is actually how a lot of porn stars actually perform, actually, to be honest. But with that said, I always give phenylephrine whenever I prescribe this medication, at least the first time, because if you have an extended duration of your erection called priapism, we don't want that. So I give reversal just in case. And a lot of times, some men who are taking these medications tend to also take the Viagra and Tadalafil, and they'll forget not to take that, and so it can increase the time span of the erection, which is no bueno. Okay, P-shot. P-shot is a very great thing to help repair the penis and actually increase the erection quality as well. So this is usually taking the blood and the growth factors and we inject it into the penis. Okay, usually you do one treatment, about 4 treatments 1 month apart. Okay. Then you can add on stem cells and exosomes. Exosomes are the signaling molecules of the stem cells, and I always recommend, if you're going if you're doing the exosomes, you'll do the PRP together, because that's where you get the most bang for your buck. It's a synergistic effect over there. But that actually helps repair. Sometimes patients, after like a couple of days time, don't and get their morning wood back. So it's an incredible treatment to add on. Another thing, great thing that recently has been seen is actually Botox into penis. Actually, about 80 to 100 units of Botox can give anywhere between 3 to 6 months of improved erection quality. On this regard, it actually allows from moderate to severe ED, patients have increased had much more increased erection quality and duration. Stiffness of the erection as compared to the control group who were injected with just saline. That's actually a very recent discovery as well. So Botox for the penis. Now, next up is shockwave therapy. Shockwave therapy is very great for the penis as well. So using this, usually doing 1 to 2 treatments a week, doing about 10 to about 20 sessions. And this actually helps with repairing the penile tissue, through the mechanism of these ultrasound and shockwave modalities. Now, last but not least is is penis pumps. Penis pumps are beneficial for the penis as well. If you stay within about 4 to about 7 millimeters mercury, even like I'd say like 5, really ideally 5 to 7. Anything less than that, really, you're not getting enough suction. Anything more than that is be too much for the penis, and put too much strain on the penis. And with penis pumps, you can get some girth increase with it as well. And now, as well as with, you can also get some length gains as well, but more the girth in particular, so the thickness of the penis. Now, let's kind of quickly transition talking about girth and length. As far as with girth, really, outside of penis pumps, there's not really much else except from a medical standpoint. We can inject some filler into the penis to increase the thickness of the penis, and that can increase the girth of the penis. Some patients will actually do inject a fat into the penis, but I don't recommend that just because bumps, the fat doesn't, even if we micronize it, it doesn't, it's not as fluid and as nice and even as compared to doing it with fillers. That said, as far as from a medical standpoint to elongate the length of the penis, there's not much except like doing penis extenders, and you can get those online, and they kind of stretch out the penis. Another thing you can do if you're doing manually is something called jelqing. But as far as from a medical standpoint, there is one thing, and it's more for show. There's a suspensory ligament right at the base of the penis where you can snip it, and that will actually just increase the flaccid length of the penis. It doesn't actually really do much to increase the overall length of the penis. So I wouldn't even bother with that if that's something on the thought of your mind. Okay. Anyway, so I kind of went over ED a lot, and then I actually touched on some other topics. But I hope this was beneficial to whoever it may be. If you have any questions, reach out to our office. Dr. Islam. Take care. Bye bye.